Okay, well, I think we will get started here this morning. This is the High Five for Mom and Baby webinar, and today we are very excited to have some wonderful guest speakers who I will introduce later. Remember, as always, this is a technical thing, and sometimes there are glitches, so if I have an issue in the middle of our webinar, please have patience with me. Again, remember, if you have any kind of background noise, we will be able to hear that. So if you do not want us to hear what you're saying in the background, please mute your line by hovering over your name, and then you'll see a little microphone symbol to the right. And click on that, and that will mute you, and you can click on it again to unmute yourself when you want to speak or make comments. If I do hear background noise and you're not muted, I can mute you, and I probably will do that for the convenience of everybody. So I think Brenda wants to say a few words, and I'll toss it over to her now.
Okay. So this is Brenda Bandy. Can you all hear me?
Yes.
Oh, wonderful. Well, thank you, Gwen. As the program director for the Kansas Breastfeeding Coalition, we wanted to thank the High Five for Mom and Baby program for using one of your regularly scheduled webinars that you do for your hospitals to share this topic with everyone. And I think it's a great partnership. And I welcome those of you on today's webinar who are KBC members. And just wanted to acknowledge that this is sponsored by High Five for Mom and Baby, and thank you for opening the doors to KBC members.
Well, you're welcome. I think it's a wonderful topic and a great venue, and I hope everybody will enjoy what they hear today and get a lot out of it. So we'll move on. If you've not been on a High Five webinar before, I always kind of have some opening slides, and today I put in our map of Kansas. This is a map, as you can see from the top there, of all the hospitals that are enrolled in High Five for Mom and Baby. In the state of Kansas, there are 69 maternity care hospitals, and we now, with the recent addition of Allen County Hospital and Mercy Fort Scott Hospital, have 60 hospitals enrolled. So we're just really thrilled with that. We also recently recognized Irwin Army Community Hospital and Geary Community Hospital as High Five recognized hospitals. So we're thrilled about that as well. So these are the 5 best practices that High Five for Mom and Baby focuses on. I think everybody here is probably really familiar with those, but I just wanted to put them up there again to kind of glance at. From research, we know that these 5 practices do have an impact on mom's experience with breastfeeding. Girolamo and all did some research that was published in Pediatrics that showed moms who intended to breastfeed for greater than 2 months, depending on how many practices they received in the hospital, this is how many of them had stopped breastfeeding by 6 weeks. So you can see the moms that got 5 or 6 practices had a less than 10% rate of stopping before 6 weeks of breastfeeding. So it really does make a true difference in what happens in the hospital, even in those first 2 days in the hospital. So today we're going to talk about reimbursement for lactation services. This isn't one of the High Five practices. However, many hospitals are very reluctant to add lactation services to their hospital unless there can be an income generated by those services. So many hospitals in Kansas are struggling financially, and it has to make business sense to them to add more services. So I think this is a very important topic for our High Five hospitals. So the purpose of this webinar is to share successful strategies for obtaining reimbursement from insurance companies for lactation support services in a variety of settings, including health departments, hospitals, and private practice. We have guest presenters, Robin from the Pawnee County Health Department and Kay from MilkWorks, which is a freestanding breastfeeding clinic in Lincoln, Nebraska, with many years of experience in this area. I hope those of you on the webinar with experience in billing and reimbursement, both the positive and the negative experiences, will join in on our discussion time. It's so very important to have those discussions, and we can really learn a lot from listening to everybody else and what worked and what didn't work. So the focus of our webinar will be on reimbursement of lactation support services, not breast pumps and equipment. So we will focus on those reimbursements for services. So we hope that to pool our shared knowledge and that this will help everybody in the state of Kansas. So I'd like to first turn it over to Robin from the Pawnee County Health Department, and I will let her explain her position and what she does there. And Robin, I'm changing you to the presenter, and I now am going to have to tell you to click on your own slides because I forgot to do that. At the top, there you go. Great. Thank you.
Okay, well, thanks, Gwen. Again, I'm Robin Sheehaw, and a little bit of background about myself. I'm a registered nurse. I'm also an IBCLC, and I'm also the Pawnee County Health Department Administrator. And last year, when the Kansas Breastfeeding Initiative grants came out, our health department was one of the organizations that applied for grant funding, and we were awarded that along with 9 other organizations, and our funding came from the Kansas Health Foundation. And the project we had put together, and you'll see it on the slide here, it's Lactation is the name of the grant project, which stands for Lactation Assistance Access in All Counties Taking Action. And basically, it involves myself and then 2 other IBCLCs, and we serve a geographical area of 20 counties to provide in-home lactation counseling, which is physician-referred, as well as prenatal breastfeeding education classes that we do on a regular basis in all 20 counties. And so that's how we kind of got interested in the third-party reimbursement. That was one of the project objectives that we wrote into our grant, that we would explore the third-party reimbursement for lactation counseling services as well as for prenatal breastfeeding education, because we knew that this grant project would not be sustainable without some sort of reimbursement in the long run. So I'm going to go ahead and advance my slide here. Very important, I want to point this out as a disclaimer. I am an RN and IBCLC. I'm not a certified medical coder or biller. There's an echo on the line again, Gwen. Okay, I just wanted to point that out because everything that we've learned has kind of been trial and error. But what I have found out, too, in the world of billing, coding, sometimes there aren't a lot of answers. You just have to try it and see if it works. Gwen, I'm having trouble again advancing my slide. I think.
Sorry, I'm fixing the echo.
Okay, thanks.
I'll advance your slide for you. Okay. There.
All right, thanks. So what we know, the Affordable Care Act mandates that insurance providers cover lactation services and supplies for new mothers without cost sharing. However, not all insurance companies are uniformly providing coverage for these services. Some procedures were grandfathered in, which means that an old insurance plan basically made no changes. Okay, you can go ahead and advance it. Pawnee County Health Department, we have been successful with both lactation counseling claims and prenatal breastfeeding education classes being reimbursed by insurers. I will point out that's mostly on the private side, and we'll talk a little bit more about that later when it comes to Medicaid. The health department is the contracting provider, and we contract with over 20 health insurance plans. Like I mentioned before, we have 3 IBCLCs that provide the lactation counseling and teach the breastfeeding classes that are billed through Pawnee County Health Department. And again, we provide services to 20 counties, and the IBCLCs travel to the client. All lactation consultation and classes are physician referred, and the referral must be for the mother, not the baby, due to the CPT and ICD codes that are being used. Now, I don't know whether, we put into our grant project that we wanted physician referrals for a couple of reasons. One was the research shows, first of all, if physicians are talking to mothers prenatally about breastfeeding and encouraging them to attend a prenatal breastfeeding education class, moms are more likely to actually attend that. So that was one of the reasons we wanted physician referrals. We wanted to see that engagement with the physician and the mother. And research also shows that when physicians talk to their mothers, encourage them to breastfeed, that the duration rates are going to be longer, not just the initiation, but the duration rates. So that's one reason we, again, engage the physicians. Okay, so all of our consultations include, and we're very thorough, I feel like. We do get a thorough history documentation. It includes the start time of a visit, the end time of the visit is documented, the total counseling time, and there can be a difference there in the time that you're providing counseling as far as the time that you're actually, in the home with the mother. And so what we're billing is for counseling time, not the entire visit. And then we also, document the total visit time. We send a summary of the consultation to the referring provider, and we document that as a SOAP note that I'll go over, which everybody's probably familiar with that. Both the client and the IBCLC sign off on the history intake form, and then all clients do sign a consent to bill insurance if they have insurance. Now, we have had some clients that have no medical insurance, and they provide their insurance information. And all clients do sign a privacy practices consent as well. Okay, as far as the SOAP notes, I'm sure, again, everybody's probably familiar with this, but it's just subjective complaint. We document the client's reason for seeking care, objective findings, which would be the result of the physical exam, including documentation of progress, the assessment, basically what the IBCLC is assessing and evaluating with the client, and then a plan, which would be an overall treatment plan, including counseling provided, as well as any follow-up visits. And then we do document follow-up visits as well to show if there's any change in the condition or treatment plan and why. Documentation, I feel like, has been very important. When we did start doing the third-party billing through the health department, the private insurers did request full records of what we were billing for. And so we had to submit everything, including the, physician referral, the history form, our summaries, everything. And I am convinced that that is one reason that we have been successful with reimbursement. Now, you'll notice the little cartoon here. It says, find your way through the maze and you will find your reimbursement. And truly, I feel like that's kind of how billing is, especially when you're trying to do something new. There's not a lot of answers out there, and you can call the insurance companies, you can try to talk to somebody, but you don't usually get very far, and that can be very frustrating. So now let's get into the CPT codes. And again, this is what has worked for our health department. Is this the only way to do it? I'm sure not. I'm sure there's a lot of other ways that you could bill and successfully get reimbursed, but this is what is working for us. So CPT codes, they are procedure codes basically for what is done. It stands for Current Procedural Terminology. So Pawnee County Health Department, we use the preventive medicine, counseling, and or risk factor reduction intervention provided to an individual. And basically those codes, depending on the number you use, it correlates with the amount of time that is spent with the counseling. So if you see the 99401, that means 15 minutes. The 02 is 30, the 03, 45, and the 04 would be 60 minutes of counseling time. We are billing, and again, as an organization, you set your own reimbursement rates, and this is what we are billing for. We figured out with the service that we are delivering, it does cost a little bit more because we have the lactation, consultants going to the mothers. And so when we set our fees, we set basically it's $50 per 15 minutes with a maximum of $200 for 60 minutes. Although you will see when I show you some slides of some of our reimbursement, and I don't know how this happened, but our 45 minutes, we have it set at $155, and so that's what we're billing for. And we didn't end up ever changing that, but I think it was just overlooked by us. So diagnosis codes, basically that's why the service was provided, also known as an ICD code or International Classification of Disease. And the only diagnosis code that Pawnee County Health Department has used for IBCLC consultation visits and classes is the Z39.1, which is Encounter with a Lactating Mother. And there are, I wouldn't say a lot, but there are very more specific diagnosis codes out there. But this is what we have stuck with. So CPT codes for classes that are used by the health department. We use the S9443, which is lactation class, non-physician provider. And all of our classes are 2 hours in length, and they follow a research-based curriculum, and they are all taught by our IBCLCs. And we are billing the classes for $230, and our average reimbursement is $162 for the classes. Now to the Medicaid part of this. This has been interesting because I've had some conversations with Brenda, and she'll appreciate this. She was questioning, well, how are you getting reimbursed for Medicaid? She's talked to them. That's not a service that they would reimburse for. I don't know how we've gotten reimbursed, basically, but we have. It's not a lot, but we've been reimbursing under the same codes that we submit to our private insurers. And it's basically for a 60-minute consultation, they've reimbursed us for $40. For a 30-minute consultation, it's $20. And we've not been reimbursed for any classes through Medicaid. But I do want to mention, I had a conversation last week with Aaron Davis, and if you're not familiar with Aaron Davis, he works with Wichita State University Community Engagement Institute Centers for Public Health Initiatives. And he has worked to update the public health coding and billing manual, and so that's why we've kind of been in conversation. When I talked to him last week, he had actually done some further research on the public health side of things, and I'm just talking local health departments. And basically what he found out is that public health really cannot bill Medicaid using those same codes that I just went through. Now, why they paid when we billed, I don't know, because we billed under public health, but they still paid. So, again, there's a lot of questions there, but apparently that is not a service that is allowed to be billed for through Medicaid for public health departments. And again, there's a lot of questions there, and he's trying to get more answers with that. Still, it doesn't make sense that we were reimbursed for some of those services. But something Aaron did point out, he said there are some codes that he has seen that Medicaid says aren't allowable by public health, yet universally almost all health departments are using the codes for billing and getting reimbursed. Basically, more needs to be researched, I think, with Medicaid, and likely it's probably going to take some legislation, I think, in the future to get more coverage with our Medicaid. As far as lactation services, because I would just imagine if private clinic tried to bill our Kansas Medicaid using the same codes that we did for public health, that would probably be the same reimbursement that you would get as well. So something Aaron did find, he did a little bit more research, and he found some other CPT codes that appear to be allowable for public health, and he did verify those on KMAP, that those would be codes that health departments would be able to use, and so we're going to start plugging those codes in for our lactation counseling visits and see how that goes. But I would just say maybe stay tuned, and a few months from now maybe we'll know more. But I think overall Medicaid probably isn't going to cover much at all with reimbursement for lactation counseling. Okay, so I wanted to show you some samples, and I'm going to have to really enlarge this because that's very small. Okay. Can everybody see that, or I probably need to minimize something on my screen? So
Robin, I don't know if they can see it, but if you have it as a PDF file, we can attach it to the recording.
Okay, and it is. It's a PDF, and I was just trying to enlarge it, and I don't know. I mean, it's
I don't know if we can do that on the slides.
Oh, okay. Yeah, because it's kind of small. If you're not enlarging it, then it's probably really hard to see. But, yeah, if you want to look through it after the presentation, you would be able to view that better. But basically, I was just showing some examples of our remittance advice and, what we had billed for and basically what we were paid for. On this first slide, the first one we billed for a 45-minute visit using that CPT code 99403. We billed an amount of $155. We got paid an amount of $155. There was no copay, which there shouldn't be. So that was good. The next one, it was just a 15-minute visit, which likely was a follow-up visit with a mother, and that was the 99401. We billed 50, got paid 50. And then the last one on that slide, it was a 60-minute visit that we had billed $200 for and had gotten paid the full $200 for that one. I'll go to another one here. This is probably a little bit easier maybe to see. And this is from Blue Cross and Blue Shield. Same thing, we had billed for a 60-minute visit using the 404, $200. That's the amount that we got reimbursed. And then there was another one on that same claim for a 45-minute visit for $155. And the next one, I mean, these are all kind of the same. It was another one from Blue Cross and Blue Shield, basically showing some varied amounts for counseling time, one for $200, $50, $155, and another for $100. There was no copay on any of those, which if we run into that, our grant basically picks up anything that the insurance wouldn't. A mother that is utilizing our services through the grant does not have to pay anything out of pocket. And then that last one on there, which we're not going to get into this, was a breast pump rental. We do bill insurance for breast pump rentals through our coalition. And go to the next one here. This one, and I don't know the specifics on this, it would have been a 45-minute visit. We billed under CPT 99403. This particular company ended up paying $50 for that visit and basically showed a patient responsibility, which again, we did not bill the patient at all for that. And this other one, this would be United Healthcare, and it's kind of hard to see, but we billed for a 60-minute visit, $200. They paid $40. And here's an AmeriGroup, which again is very hard to see. And it was kind of the same thing. We billed for 60 minutes, $200. They paid $40. And then the one down at the bottom would have been a 30-minute visit that we billed $100. They paid $20 on that one. And then I have some that was just showing the classes here. This would have been, you can see the code we used, the S9443 lactation class. We billed $230. This plan paid $128. And here's another one, same thing. And then this one, the particular plan paid $195 on for the class. And I believe that's all of my slides.
Okay, great, Robin. I did have one question.
Sure.
Are you billing any for CLCs or only IBCLCs?
We are only billing IBCLCs because that's all we have working on our grant project. My assumption would be with the codes that we're using, you could probably bill you know, with a certified lactation educator. But
okay.
you know, that's just
you
how
just
we're
haven't
billing.
tried it.
We just haven't tried because that's
okay.
all we have working with our grant project.
Great. Okay. Well, I want to now turn over our discussion to Kay from Milkworks, and I will give her control and hopefully here in a second, and let her explain her position at Milkworks. And
yes.
Okay. There you go. You're on.
Great. I'm pleased to be with you all as a neighbor from the north here. I have very few slides, so I'm glad that Robin did such an extensive job of explaining things, which are, there's a lot of duplication, which is good. At least we're billing the same way, using the same types of codes. That makes it a little less confusing in this complex insurance world that we're thrown into the middle of now. I am one of the founders and the operations director of Milkworks. We have been around, let's see if I can get my slide to change here, there we go, since 2001. We are a 501c3 nonprofit, so we are eligible for tax-deductible grants and donations, which has been part of the reason we have stayed alive, although that is a very small part of the revenue that we bring in. As Gwen mentioned, we are a freestanding operation, so we are not tied to any other facility, clinic, hospital, public health, or anything. We are just Milkworks. That's all there is to say about that. We were a group of 7 moms and with healthcare backgrounds who identified a lack in coverage of, or lack of provision of services. We've had a lack of coverage for years, but back in the early 2000s or even before that, and out of that sprung our grassroots operation of MilkWorks. So that's a little bit about our history. We are made up of 9 IBCLCs plus Dr. Leeper, who many of you know, and she is joining us today from across the ocean there. So hi, Kathy. We have been billing creatively over the years, and we started being able to bill under the insurance plans with the ACA as of August of 2012. What the law says, as Robin explained, was that unless they're grandfathered, they must provide preventive services without cost sharing. And that means without deductibles, without copays, without coinsurance, but we still see many companies that are tacking those on and billing under the medical rather than the preventive side of the insurance spectrum there. What must be provided: comprehensive lactation support and counseling by a trained provider during pregnancy and or in the postpartum period, and costs for renting breastfeeding equipment was one of the original wordings of the law, and so that is part of the issue we've run into with billing that makes it so difficult is the law is very vague. What qualifies as a trained provider? We know there, in the lactation world, there are many different acronyms for the different providers out there. Here in Nebraska, the standard for being able to be credentialed as a lactation provider for most of the insurance companies is that they are requiring an IBCLC. What is lactation support and counseling? That can take many forms, everything from classes to the one-on-one consultations to home visits to, you know, there's a whole realm of things that could be included under that, so it's not defined. And should there be limits on how long a mom can obtain it? So is this one visit? Is it many visits? Is it for the first 2 weeks after delivery, or as long as she's breastfeeding? And we see that all across the board, too, in the insurance world. As far as lactation support and counseling, we also have many companies that we have talked to that say, well, they get that in the hospital. That's part of their maternity benefit package. And so it has been helpful for us that we are a freestanding facility, so we don't have to try to defend why this was not done while the patient was still in our facility type of thing, which we have run into that on more than one occasion. It's also difficult because of the vagueness. Each state and insurer interprets the law how they see fit. So Blue Cross, as an example, has locations throughout the country. I think there are several in Kansas alone, and each one of those has their own legal department, their own interpretation of how they are going to provide these services. And so just because a mom has United Healthcare or Blue Cross Blue Shield or one of the big providers, it does not mean that her coverage is going to be the same as someone else who is insured under that same company. There also doesn't seem to be any immediate obvious penalty for noncompliance. So those insurers who have elected not to embrace this or are minimally embracing this, there doesn't seem to be too much in the way of ramifications at this point for choosing that route. One of the things, Nebraska and MilkWorks has been very lucky because I think a lot of that is, as Robin had said, you know, sometimes you don't quite understand how things work. You just keep trying different things until you find something that does. When the ACA first came about, Blue Cross Blue Shield actually enlisted several physicians to ask them, what does this mean? How would you interpret this? What should we be offering? And as a result, they started off with a great model for our state and have done most things very well in terms of what they have reimbursed. And you can see that under the National Breastfeeding Center scorecard, they've been given a score of an A, which the last one in 2015, Blue Cross Blue Shield Kansas, had a D+. So I feel fortunate that we have been navigating the billing system here from Nebraska rather than from Kansas. In the website for the Nebraska Breastfeeding Center, I see there's an error. It's just center. It's not another ER on the end of that. If you are wanting to access this site, you can see they have scored approximately 100 companies based on a number of criteria, such as whether they cover classes, visits in the hospital, home and office, if they're requiring a qualified lactation counselor, and whether they have to be in network or can also be out of network, and then things regarding pumps, availability of that, and are they able to access care from multiple sources. Those are a few of the things that have determined the scorecard that the National Breastfeeding Center is using. So how to get started? Contacting the credentialing department of an insurance company is how I have done the majority of my initial inquiries and to get the ball rolling. If you aren't able to access the credentialing department, going through the provider relations that you find on the back of almost anyone's insurance card, it has a number that you can call for providers and can get started that way. But most of them will refer you to the credentialing department of the insurance company. You can also check out their website, because often that will lead you to the credentialing department as well. One of the unique things, as we are credentialed as individual providers for most of the insurance companies, and we are not in the grid of what they are used to providing services under. So they've had to kind of fit us as a square peg into a round hole. So what we have found is that sometimes we will get something addressed to us from an insurance company that may be coming in under our name as LPN, as several of us are RNs, so sometimes it comes under that. But the IBCLC alone, they've had to tweak their systems to be able for it to put us into their packaged, however their programs work for credentialing providers. So that's made it more challenging for the insurance companies, and therefore some of them have chosen not to try to figure out how to do that. We have a couple of companies, which I'll be getting to here shortly. Oops, all of a sudden that didn't like it. There we go. So as you can see, Nebraska, Blue Cross Blue Shield, Aetna, Midland's Choice, which is a network of providers, have all chosen to credential us individually. UHC, UMR, Golden Rule. TRICARE has been kind of a question mark. Maybe some of you can teach me something about TRICARE, because we keep trying to figure out how they're doing things. It's been confusing. And GEHA, which is a government health plan, have not credentialed lactation consultants in our area at least, but we are getting reimbursed by filing through Dr. Leeper's provider number, which they have encouraged us to do. So we have not taken that on just on our own, but they have told us rather than reinventing the wheel that we could just bill through her. So it's been a very huge benefit to us to have her on board with our organization. Medicaid in Nebraska does not reimburse at all. We are in the throes of a brand new managed care plan under Medicaid that will start in 2017, and there will be 3 managed care providers, insurance companies, that will be offering services and benefits, and we are in the process, which is what we have been very busy at the last couple months, in trying to get them on board to take this on as an important area to be reimbursed. So as far as the coding that we use, it's very much like what Robin had said earlier. The 99401 to 404 codes are our main codes that we're billing under. Again, the V39.1 ICD-10 code is the only code that we as IBCLCs are billing under. The ones that are not credentialing us individually are requiring that we bill under the 99241 through 99245 consultation codes, with the exception of TRICARE. They still want us to bill under the 99401 through 404 codes, and we're billing through United Healthcare, so it's kind of interesting that they're accepting those codes under TRICARE, but not under their other commercial plans. Some insurers have unlimited consultations that they're covering. Some limit the number of appointments, as in 3, or TRICARE limits to 6. Some limit to 1. Coverage for classes, which we do offer and we do bill for, bill the insurance companies for. We bill per individual. It sounds like maybe Robin is billing by the class rather than per the individual in the class, but each individual is how we bill for those classes, and some of them are covering, some are not, some covering completely, and many are only covering at about 50% of the billing rate, and we're billing at $30 per class. We do spend a huge amount of time on the phone with insurers. We find a lot of inconsistencies, and I'm curious whether Robin has found that as well, where we may have someone who has been seen 3 times, and even on the same EOB, explanation of benefits, that we receive, one of them may be covered completely, one of them may not be covered at all. Or they may pay different amounts for the same service, which is always interesting to me. Sometimes they try to apply a co-insurance, and maybe they will apply it to one claim, but not the other claims for the same mom. And the one that I mentioned earlier, that oftentimes they will say this should be part of mom's maternity coverage and not billed separately. But since we are an independent facility, we usually don't have problems with that. So those are my slides that I have, which were very few, and I welcome your questions. This is a very old picture of me doing a lactation consult, but I am an RN and have, before I got thrown into the insurance world, which I too have no experience in that other than the trial and error that Robin said that she experienced in learning how to go through all of this process. And so we are still learning. It's a never-ending process, and it keeps changing, because now even those plans under Blue Cross Blue Shield and under United Healthcare, where we kind of had a feel for how they were reimbursing in the past, they're coming out with hybrid plans now, or what they often call their high performance plans, which the benefits are far different in that. We have developed an insurance questionnaire that we encourage all of our clients to use, and I can sure get that to you if you're interested in having a copy of that. On the lactation consult side of things, we're having them ask if their insurance plan covers women's preventive services under the Affordable Care Act, and if the answer is yes, then are they covering IBCLCs? Are there any restrictions? Is MilkWorks in Lincoln or Omaha? We are located now in Omaha as well as of March of last year. Approved providers under their plan. If MilkWorks is not an approved provider and is out of network, does their plan still cover lactation services for out-of-network providers, or do they cover them differently? And are breastfeeding classes covered? Are there any other benefits or restrictions related to breastfeeding support under their plan? So if they don't have any coverage, then we still encourage them to ask on the pump side of things if there's anything else on their policy elsewhere. But if they don't have coverage under the ACA, most of the time they are not able to get any reimbursement under insurance. But even that varies some. Those are the ones I think that we see more of the co-pays and co-insurance, subject to deductibility, that type of thing come through. So we do file for anyone who asks us to file for them, but we do find that some are more consistent at paying than others, and sometimes even if we aren't individually credentialed with that company. So it's interesting, and it is kind of a maze, and it isn't always very understandable why we are getting or not getting covered for what we are getting covered. So I'll turn it back over to you, Gwen, for any questions or for the next presenter.
Thank you so much, Kay. I appreciate your information so much. I do have a couple questions that have come in on the chat. One is for Robin. It says, what if a patient doesn't have insurance? Do you have a process where you transfer the cost to your grant?
Yes, our grant picks it up, and we let the clients know that up front when we're requesting their insurance information, that if they're uninsured or if their plan, doesn't cover the cost of it, they won't have to pay anything out of pocket at all.
Okay. And then a follow-up question, I think, for maybe either one of you is, are there any problems with billing for services provided by non-licensed staff, such as when you just have an IBCLC and not an RN?
Go ahead,
this is Robin. Yeah. We haven't had any problems with that because I will tell you, now I'm an RN, but my other two IBCLCs are not licensed. Neither one of them are nurses, and we have been able to bill for services.
Okay.
And we have several who are not licensed, and we have been able to bill for their services as well.
Great. Then another one, do the CPT and ICD codes cover services provided in a hospital or only in outpatient?
Well, I will attempt to answer that. Since I am not working in the hospital, I can't answer that totally with confidence. But what we have found is that if the hospital has more than one tax ID number, it may be easier for them to get reimbursement for things they're providing outpatient. I am not aware of anyone in Nebraska who is getting reimbursed for the in-hospital lactation services because they do want to put those under the umbrella of maternity care. But if they're doing outpatient care, I have heard from conferences and such I've been to, where some, if they have more than one tax ID number, to be able to do it under a different tax ID number has made that more possible.
Okay. Then this is another one kind of, I guess, kind of on the same lines. Has any other CAH, I don't know what that is, CAH hospitals been able to receive reimbursement for lactation services? I've been told by our billing office that we aren't able to bill for lactation services even with an IBCLC because we're a CAH hospital. Oh, critical access hospital.
Access, yeah.
Yeah.
I don't have an answer to that question.
I don't either. I'm not real sure on the hospital side of things. It would seem, if they were doing outpatient billing that they should be able to do that, but again, I don't have that experience.
Okay. And another question for Robin, is $230 for the class, is that individual person or per class?
That is individual person for a class. And, maybe at some point we'll come down on that price, but what we're finding in our rural locations, again, it costs more to deliver this service just based on us traveling, to set up for the class. And a lot of times our participation is quite small in some of our counties. We might just have 2 or 3 individuals at a class. So when we started doing our billing, because it is, the organization basically that sets your own prices for your billing, I told my biller, I said, go high, because we can start out high and see what they pay. And, as we go along, perhaps at some point we'll reduce that price because, if we were getting a good number of individuals at a class, that would, to me, that would be, over an amount that we would need. But again, when you're seeing 2 or 3 individuals at a class and your IBCLC is maybe traveling 100 miles to go to present that class, it does cost a lot more to deliver that service.
Okay, great.
And I do agree that if you're going to start doing this, you do want to start high. What we are starting to see is, for the first time since 2012, this year's reimbursement rates have come down rather than increased. So they're contracting a little bit on what they are willing to pay for services. We've seen this with 3 different companies. So we hope that's not a trend that's going to continue.
Yeah. So if there's anybody else out there that has questions, feel free to unmute yourself and ask your questions with your voice. And or you can feel free to still go ahead and type them in and I can ask them. But do feel free. I do have one more. Somebody has typed in, if it's an outpatient service, a critical access hospital should be able to bill for this. So I don't know. I don't know about that. Then does Robin bill for phone or email or text lactation counseling or only in person?
Yeah, we only bill in person, and I'm glad somebody asked that question because I will tell you, we do a lot of basically free phone help. A lot of times initially when we get a referral, of course, we always contact the mom by phone first, and in many cases we're able to help her by phone without even making a visit, you know, if it's some minor problem. And then we do follow-up phone visits after we've made a consultation. So there's a lot that goes on in the background that we're not billing for, and quite honestly, I don't think you can bill for a phone visit. I could be wrong on that, but I don't think that you can.
As an IBCLC, I have not seen any that are reimbursing for phone visits either.
Okay. In Kansas, is anyone billing under IBCLC using their NPI number or always billing under a physician?
Well, I'll speak on this. For our Pawnee County Health Department, we are not using IBCLC NPI numbers. We're billing under the health department, basically as the provider.
Okay. So that kind of answers this next one, I think, too. Is Robin and her other IBCLCs credentialed with individual insurance providers?
No. Basically, again, we are a contracted provider. Pawnee County Health Department is with each of these insurance companies, so we bill under the umbrella of the health department.
Okay.
For those who are interested in seeking IBCLC individual provider, we have recently been eligible to join the CAQH system, which is what all of the other providers are using to go through their credentialing process, their application forms. They have kind of a centralized location for that through the CAQH system. Up until just in the last few months, IBCLCs were not a category that were able to put their information on that system, and insurers, again, would scratch their head about, well, that's how we credential is through the CAQH system. And that has recently become available to IBCLCs.
Great. Okay. I did put up a slide here on some United States Lactation Consultant Association webinars or USLCA webinars that are available. These are, there is a charge for these, but these webinars have been recorded and are available if you're interested in more information. Also, to let you know, this webinar has been recorded, and at some point it will be put up on the KBC website and for High5 hospitals on the High5 website. So please do access that later, look at it later, because that will be there. Then I just got a question, speaking of that, Kay, how do you access the CAQH system?
Oh, we did it with one provider so far, so I'm not adept at it yet, but I think all you have to do is Google it, and you will find out how to get access to it. I have called them on several occasions, and it was very easy to do. So I don't have that in front of me, but try Googling, and I think you'll get there.
Okay. Excuse me, do any of the insurance companies require pre-authorization?
Not to my knowledge. We haven't ran into that.
With one of the new companies, the hybrid plans, they are requiring that it be a referral from their primary care provider. So that is brand new as of a couple weeks ago under United Healthcare. One of their hybrid plans is requiring anything that isn't being provided at their primary health care provider's site has to have a referral accompanying it.
Okay. Brenda says you will, when you Google CAHQ, make sure you get the Pro view, P-R-O view, as this is the newest version. Question for Robin. Since we are talking to hospitals mostly, is it beneficial to partner with the health department to provide outpatient services, in your opinion?
Yes, I think it is, and I'm hoping from our project that this will be something that could maybe happen across our state. You know, just knowing every county has a public health department, and if we could be able to access an IBCLC through every health department somehow, that would make it so much easier with these delivering hospitals when they're sending a mom home. All they would have to do is refer to their local health department, and they would know that there's going to be somebody that's knowledgeable that's going to be following up with this mother.
Great. Another question for Kay, I think. Do you ask for a referral from the PCP when they arrive? If they don't have one, do you contact the PCP for the client?
With this new plan, they are allowing 5 days from the date of service, so it can be backdated for 5 days. So the moms have, it says right on their card that referrals are required, and they are well aware, we're being told by the company, that they are well aware of any services that are being provided elsewhere will require a referral. So we've had a couple of them come with those in hand. A couple we have had them then contact their primary health care provider about getting that referral. If I can add one little thing, as far as getting coverage with insurance companies, probably one of the things that has worked best for us is motivating your clients to request it of their insurance companies. Their companies do listen to their members. They want to keep their members. And we have had a couple of them approach us after we tried unsuccessfully several times, saying that they've had enough requests for this service that they're now ready to look into it. So that's always exciting when we get that phone call.
Great. Well, I do want to wrap up our discussion since we are at 10 o'clock, but I want to remind High5 hospitals that are on our webinar today that you are able to submit a hospital self-assessment at any time to me, and once you are at 80% on that hospital self-assessment, you are eligible for recognition by High5. And recognition includes these following things listed on the slide. But if you think you are getting close to that or you are at that and wish to be recognized, please let me know and I can send you the form and we can get your hospital on our recognition list. I have one last question about will we get a PDF of the slides, and I do not think we have that, but I will look into it. But for sure the slides will be visible on the recording that we post on the website. So once again, I want to thank everybody for attending today. I appreciate your comments and your questions very much, and I appreciate your participation. I want to especially thank Robin and Kay for your wonderful information that you have blessed us with today. And I will get information up about our next High5 webinar when it's available for the High5 hospitals. And again, thank you all very, very much for attending, and this will be the end of our session today.